With that, I think it's worthwhile to mention some of those higher revenue producing areas. Just again, what our experience has been, if that inspires anything from you guys. But as Leo was saying, our personal training or athletic performance programs that we offer after formal physical therapy, when the skilled part of physical therapy, right, is no longer needed, we don't discharge. What do?
Excel.
We excel, and we go into our aftercare programs. And so we had 38% growth in that last year, and just that program alone generated approximately $134,000 in revenue for the practice. Also, one of our elite and innovative services, as Leo said, is dry needling. This is something that we utilize very frequently. Very much it gives our athletes better, faster, immediate results. Do we save them time with dry needling? Absolutely. Do they get value when they can see under the ultrasound what we're able to show them and then needle it, and then 2 or 3 sessions later show them under the ultrasound that they have scar tissue, that their tear went from 75% to 25%, to show them that, you know what, look at your ankle ligament tear. It's all scar tissue now. You're okay to play. You can play. We're going to tape up your ankle. You can play tomorrow. To have that, it's amazing. But anyways, so just from, again, dry needling, something that we've added to the practice, something under Leo's belt, in revenue last year, that was another $115,000 that we brought in. So again, we talk about declining reimbursements, and we talk about those sort of things. These are areas that, yes, it helps from a reimbursement standpoint, but ultimately, does it change our patient's life? 100%. Does it go through the lens of autonomy, excellence, and innovation? 100%. And are we getting our athletes better, faster by doing this? 100%. So for us, it's a complete win. And since we were just talking about dry needling, I'm going to do a little dry needling plug for a second. So just in case you didn't know.
Yeah, lower body class is next weekend. So far I have one coming if anyone else wants to come join. But I'm privileged to be able to, share the techniques. I love research. I love manual therapy. So dry needling is a win-win in our practice. After Joe's done the dirty work with the EMG, it makes it easy to say, hey, listen, the EMG came back clean. It's myofascial. You need dry needling. You need cupping. Then we're going to follow it up with the new fit. Or if it is radiculopathy, to be able to have those tools to say, yeah, it's your L5. And that's how we're going to know exactly where to dry needle, exactly where to put the new fit pads. So it is it's a grand slam in our practice. And with anyone who is working with, those people either with chronic pain or athletes that want to get better faster. So, yeah, happy to answer any questions about it.
Going back to the kind of like how Leo does with our, E&I services. So that's our cash base. It's it's an absolute slam dunk when I do my diagnostics. So our goal is evaluation. And if it's prime, they're going to do it on the first day. But if it's an evaluation, their very next visit is a follow-up. It's an EMG, it's an MSK. Right then and there, I find what's going on. So if I'm looking at a shoulder, I find a partial tear. I am prescribing to that patient. I'm telling them, next time you come in, we're going to start dry needling. We're going to dry needle under guidance of the MSK, and we're going to actually go right into the site. We're going to create growth factors. We're going to promote healing. You don't have to worry about surgery. Then when they come back in, that therapist doesn't have to do anything. They're already saying, oh, I'm doing the dry needling today. When I have that person come in on a shoulder and it's just inflammation, it's a ton of inflammation around the long head of the biceps. There's no tear. They can, they're totally relieved there's no tear in general, but I'm prescribing them. The next time they come in, they're going to be on the new fit system. Newbie's going to be on there. We're going to have it on an anti-inflammatory setting, and you're going to go through all of your exercise with that on. They come in, the therapist doesn't have to try and you sell that service. It sells itself by me doing the diagnostic. Same way as Danica said, when I do an EMG, if it comes back clean, as we talked about earlier, why is it radiating from their neck all the way down their hand? And I'll find, is it the whole hand? Yeah, it's the whole hand. You know, I had a person who had an MRI done, was going to have surgery. She came to us. I did EMG. It was completely normal. She did 4 sessions of dry needling and her hand came all the way back. Her strength was like, I don't know, 25, 30% different, but she 4 sessions and her pain was gone just by targeting the myofascial and up in her upper trap. So we see this over and over and over, but it's again, slam dunk to get into our cash-based services, because once they know exactly what's going on with the diagnostics, they're just like, done, let's go. Yeah, totally.